Hello, I'm Dr. Rohini. Today I'm going to talk about baby movements in pregnancy. When it's the first time a woman should perceive the baby's movements? So, in case of a primigravida, that is, if the woman is pregnant for the first time, she will feel baby's movements at around 20 to 24 weeks of her pregnancy. But if the lady is pregnant for the second time, then she will feel the baby's movements for the first time, which we call as quickening, around 16 to 20 weeks of pregnancy. Next, I will tell you what is the pattern of baby movements. So initially, when the baby starts moving, the baby is small, and when the mother perceives it, there are a lot of movements because there are turning around movements, somersaulting movements. So till 32 weeks, you will be perceiving a lot of excessive movements. But after 32 weeks, the movements reduce because the baby becomes bigger. There is less space around the baby to move around. So you can feel only kicking movements. Now, how to monitor the baby's movements? So usually we advise the patient to start monitoring from 28 weeks of pregnancy. So there are two methods. One is DFMC, that is the daily fetal movement kick charting. So what we advise in this for the patient to the patient is that after every meal, the patient should concentrate on baby's movements for at least 1 hour. And if there are around 3 to 4 movements, then it is fine. If in case the movements are very less and if there are no movements, then it is a signal of alarm. Now the second method is that we tell the patient that they should perceive at least 10 movements within 10 hours of the day. But what we usually prefer is the DFMC method. Why are we concerned about baby's movements? So, whenever the baby's movements are less, sometimes it may mean nothing at all. Sometimes baby may be having a prolonged sleep period and that's why baby is not moving. But the second thing which we are concerned about is that baby is in some kind of distress, and its way of showing that it is in some kind of distress is that it stops moving. So it should be taken as an alarm signal, and we have to monitor how the baby is functioning and how the baby's well-being is. So next, what do you do when the baby's movements are less? So you have to immediately go to your obstetrician, you inform your doctor, go to the hospital and check the baby's heart rate. If the heart rate is fine, next what we advise is we advise a scan for the baby in which we see the water around the baby, that is the amniotic fluid levels, and also the blood flow to the baby. So these things have to be checked. In case if the water is less of the blood or the blood flow is reduced to the baby or the baby's weight is smaller, then we have to monitor the baby more frequently, see heart rate, and in case if it's very grossly abnormal, we may also have to plan an early delivery.